I think about 30 years, I think I can't believe how the time has flown. It's both amazing to have reached 30 years, but also as a co-founder, I still feel like we have so much more to do.
I mean, my gosh, what a renaissance. We created this place. This is a unique place we created where, which I don't know that it exists anywhere else in the world.
What I've said in the past is that in some ways it's a love story, because I married Tim, who's a virologist, and instead of panicking, he decided to change his whole focus of research to search for a cure for hepatitis B. And he went to our friends Paul and Jan Whitty, who are local, well-known humanitarians and philanthropists, and was sharing this story with them. And they immediately said, we have to do something.
And in the very early days, the Whittys were really supportive and instrumental financially and with hard work. And they're a big part of how the foundation started to get some legs under it.
There were no therapies, that's for sure. The virus had been discovered by Baruch Blumberg and his colleagues, and Blumberg and his colleagues made a vaccine, so it was preventable. And most of the world told us where we went that hepatitis B isn't anything to worry about.
When I was diagnosed with chronic hepatitis B in the late 1980s, it was on a routine physical employee exam, and the employee health doctor called me down to her office and told me I had hepatitis B. At that time, hepatitis B was treated like HIV.
When we first started, there was very, very low awareness about hepatitis B. Most people didn't know anything about Hep B education. There was no education happening. There was no policy focus or advocacy regarding hepatitis B. And we didn't have any FDA-approved drugs.
I lost my job. My child was kicked out of daycare. The hospital was trying to figure out what to do with me because they had no policies.
And then there's a lot of fear. Am I going to die young? What do I tell my family members? How can I still work? Or if I want to can I become a nurse? Can I travel? Can I get a travel visa? Can I get a work visa? I mean, these are real issues. In a lot of countries, you cannot work. You cannot get a visa to that country if you have hepatitis B.
Initially, we started, as just a virtual organization, basically a kitchen organization, taking calls. We just got a phone number, took telephone calls from other individuals, patients usually, who were interested.
But somehow it was amazing that patients found us. I mean, we were fielding phone calls, answering letters. When we put up our website in 1995, it literally opened us up to the world.
So in the U.S., hepatitis B disproportionately affects foreign-born individuals or people who are children of immigrants. And so when you're asking what my population looks like, it's very diverse. I mean, we happen to serve a more Asian crowd, but I get a lot of patients who are originally from Ghana who have Hep B. I have people from Russia who have Hep B. I have Latin Americans. And so it really is not, one kind of person at all.
Our mission at the Hepatitis B Foundation is, one, to find a cure for hepatitis B, but also to improve the life of all those living with hepatitis B worldwide. So almost 300 million people who we feel responsible for, helping them, helping improve their lives, helping them find access to care and treatment, helping them feel better about living with hepatitis B and live longer.
I went to work with Baruch Blumberg, the Nobel laureate. I went to him and asked him early on, even before there was a foundation, would you help us? And of course, he was extremely supportive. He was associated with so much good, and he was so nice and so humble.
The reason I got involved with the Hepatitis B Foundation was because it had the promise, when it first got started, of being an important center for hepatitis B research.
So hepatitis B is really a silent epidemic. There are almost 300 million people worldwide living with chronic hepatitis B. Of that 300 million, almost 1 million people die each year from liver cancer or liver failure.
The mission has always been the same. What we could do changed over time. So when we started, we were pretty clear about it, and in some ways naive and ambitious, and maybe it's a good thing. We were ambitious because our goal was to cure hepatitis B.
And so on a day-to-day living with hepatitis B, I mean, the signature characteristic is fatigue. It's just the liver is the engine of the body. And having a liver infection like hepatitis B results in increased fatigue. And having talked to literally or communicate with tens of thousands of patients over the past 30 years, fatigue is really the biggest problem.
I saw a statistic today at the Hepatitis B Foundation Blumberg Institute. We had seminars, and the speaker said only 1% of the people in the world, less than 1% of the people in the world who have chronic hepatitis B are treated for hepatitis B, and a little bit more than that are followed by screening. Can you believe that?
So living with chronic hepatitis B is like living with a time bomb. You never know when the disease is going to result in liver cancer or liver failure.
This is a terrible disease if it's not managed, and it's absolutely preventable because if you have chronic hepatitis B, now you can be screened and the cancer can be monitored. It's not perfect, and you can be treated, so you can repress the likelihood of getting liver cancer, and that's why it's just really unforgivable at this point for people to not get proper treatment in the United States.
What we were learning from the support groups, and later on for 10 years we held a patient conference, what we learned from that was the amount of discrimination that was occurring.
You know, a little while back, my daughter was accepted into a university's accelerated nursing program, and she was excited about her future as a nurse. But the university was not aware of current policies, and the moment they found out that she had hepatitis, they put a stop to the process and really created some very difficulty for my daughter. We were able to find the Hepatitis B Foundation and reach out to them for their assistance.
2001, my wife and I adopted a son from the Ukraine. And he was only 5 months old at the time. Upon getting back to the United States, we discovered that he tested positive for hepatitis B. So we started looking for resources to help us understand the disease. And my wife actually found the Hepatitis B Foundation online and had someone call me from the foundation, a very nice woman, to talk me off the ledge about my concerns.
We received a phone call from a woman who had just given birth a few days before. And this was a woman in the US who has chronic hepatitis B. So when she was leaving the hospital, the nurse said to her, because you have hepatitis B, you can't go near your baby. You can't touch your child, you can't feed your child, and you can't hug or kiss your child. And so she called us in a state of despair. You can't transmit hepatitis B casually. There's no reason why she couldn't love and hold and cuddle and kiss and feed and take care of her baby. And so we talked her through it. And at the end of the conversation, she was a different person.
You know, we're lucky we had a good ending to our story, but there are plenty of people that don't have a good ending. And that's why I stayed involved. And, you know, we're working towards finding a drug to cure this disease.
There have been legislators, and they shouldn't go unnoticed. The couple I want to talk about the most, or at least make sure I mention them, is Jim Greenwood, who started with us as a state representative and stayed with us all the way to now, where he liked to say, and I'll quote him, I rode the wave of hepatitis B awareness to higher office. That's a quote from Jim Greenwood.
The growth of the Hepatitis B Foundation over the past 30 years into a dynamic global organization serving the 300 million people around the world living with hepatitis B, as well as their families, their healthcare providers, and society at large, is an amazing success story.
The Hepatitis B Foundation has been instrumental in making hepatitis B part of the conversation, nationally and globally.
The Hepatitis B Foundation, it has been played a very important role, one, in the thousands of individuals' lives who we've now spoken to and touched personally. People calling, us helping, linking them to their doctors, making sure they get that screening that we're talking about. Let's start with that I think is very, very gratifying and rewarding. But then more generally, the Hepatitis B Foundation has been responsible for legislation.
We have been instrumental in prioritizing hepatitis B at the federal level, putting together a grassroots advocacy network of thousands of people who are there to share their stories and to make sure that to help make sure that there's enough money to address hepatitis B at the public health and at the clinical research level.
We've played a role in moving some companies to researching hepatitis B. We've played a very important role, probably the decisive role, in legislation involving anti-discrimination against hepatitis B.
And on one of the first World Hepatitis Days, we were invited to the White House. The White House hosted a World Hepatitis Day event, and it was incredibly memorable to me, not only because for the first time the White House was recognizing hepatitis B as an urgent public health priority, but also because Joan Block received an award.
Then, of course, there's the creation of our research institute, and now called the Baruch S. Blumberg Institute. The finest minds in the world have come to our center to start new companies.
We are at a very exciting point in hepatitis B where there's so many new drugs that are in development and will be entering clinical trial. I listen to the scientists, and the scientists are optimistic that we will have a functional cure for hepatitis B within the next 5 to 10 years. If they're optimistic, I'm optimistic.
So I've definitely seen a Hepatitis B Foundation grow a lot over the years in the kind of work it's done, its breadth and its depth, and also its recognition, its level of interaction on a national and policy level.
The future for the Hepatitis B Foundation is to make sure the following, that we greatly increase the number of people who are screened for liver disease with hepatitis B, greatly increase the number of people who are treated for hepatitis B, and make sure that there is another wave of hepatitis B and liver cancer therapeutics in 5 years.
The prize, the ring you want to grab at the end of the day is the cure, the complete cure for the disease, for hepatitis B.
Our success is due to the quality and the commitment of the people who are working with us, either as volunteers, board members, or the staff and the many public health professionals and basic scientists. These are people who could have chosen to work for other organizations. They chose to work with us, and we could not have achieved as much as we have in the past 30 years without the real dedication and commitment of these people, and of course the donors.
Individual donors are probably the most critical people that we have. So it is one of the most important sources of funds for us. We rely on people who feel like hepatitis B and the people we serve are something that's important to them.
I hope people give to the Hepatitis B Foundation and the Blumberg Institute because they believe in us. They know that what we're doing for people with chronic hepatitis B and liver cancer is almost unique, that we've proven our track record, and that we're the best hope for a nonprofit organization, the best hope out there to reach people with chronic hepatitis B. We're the best hope there is.
I'm incredibly grateful, and we are all incredibly grateful for the people who have given of their time and of their money to support the work that we do. First off, those people, they're putting their trust in us. So we have had long-term donors who trust the work that we're doing and who find meaning in the work that we're doing. And we are gratefully, very, very gratefully accept their funds and really want to thank all of our supporters and our donors. We couldn't do it without them.
I walk into the lab every day and I see this 3-building, 120,000 square foot complex with 200 scientists and outreach professionals working. And they're here because we did this. It's quite overwhelming.
If we want to eliminate hepatitis B and we want to save lives, then people need to demand action. And if we could get every one of those 300 million people who have Hep B, if they shared a little bit of their voice, can you imagine the difference we would make?
I mean, my gosh, what a renaissance. We created this place. This is a unique place we created where, which I don't know that it exists anywhere else in the world.